When it comes to clinical trials, the quality of your lab data is everything. It's simply non-negotiable. In this explainer, we're going to build the blueprint for getting that right every single time. And that blueprint is built on standard operating procedures, or SOPs, specifically through the lens of good clinical laboratory practice, or GCLP. So let's just start with a big question, the one that every single one of us in this field has to answer. How do you make sure that every action, from the moment a sample arrives to the final report, is done the exact same way every single time? Because patient safety and the integrity of the entire trial hang on that answer. This is the challenge GCLP was created to meet. All right, here's our game plan. First, we're going to look at why GCLP even needed to exist. We'll talk about the regulatory gap. Then, we'll see how GCLP fills that void. After that, we'll dive deep into the blueprint itself, the SOPs, and finish up by seeing how this all comes to life in a real-world lab. To really get why GCLP is so important, you have to understand the problem it was designed to fix. See, for a long time, labs working on clinical trials were stuck between two different sets of rules, and neither was a perfect fit. Yeah, it was a real head-scratcher. On one side, you had good clinical practice, or GCP. It's fantastic for protecting patients, rights, safety, all that crucial stuff. But it barely says anything about what actually happens inside the lab. Then on the other side, you've got good laboratory practice, or GLP, super detailed for lab work. But it's for non-clinical testing, like on pharmaceuticals or pesticides, not human samples. It completely misses key things like patient consent. You see the problem? A huge gap right in the middle. So this gap wasn't just an inconvenience. It was a genuine risk to the quality of clinical trial data. Something had to be done to create a single, clear standard for this very specific type of work. And that's where good clinical laboratory practice, GCLP, comes in. Think of it as the perfect bridge. It takes the patient-first ethics and consent principles from GCP and fuses them with the strict process-driven quality systems of GLP. The result? A single, unified standard that ensures lab data is not just accurate and reproducible, but also generated ethically. Okay, so that brings us right to the heart of our training today. This is where the rubber meets the road. We've talked about the why of GCLP, now we're getting into the how. How do you actually do it? The GCLP guidance itself couldn't be clearer. It says written procedures, or SOPs, are the mainstay of the quality system. I love that word, mainstay. It's not just a part of the system, it's the central pillar holding the whole thing up. They're not just some documents you stick on a shelf, they are the living foundation of quality in your lab. Now here's a fun one that's absolutely crucial. Before you can even think about writing an SOP for a technical process, you need a procedure for how you handle your procedures. It's often called the SOP on SOPs. Let's imagine a lab, we'll call them Apex labs. Their very first step to GCLP compliance isn't writing an SOP for an assay, it's creating this master document that controls how all their other SOPs will be written, approved, and managed. It's about building the system right from the ground up. And every single SOP at Apex Labs has to follow this exact life cycle. It starts with generation, right? It has to be written by someone who actually knows the procedure inside and out. Then it's got to be authorized, reviewed, and signed off by someone qualified. And it doesn't stop there. It needs to be reviewed regularly to make sure it's still accurate. If something changes, you follow a strict amendment process. And finally, when it's obsolete, you can't just throw it away. It has to be formally withdrawn. It's a completely controlled closed-loop system. So you might be wondering, what exactly do we need to write SOPs for? Well, the GCLP guidance is very specific. For a lab like our hypothetical Apex labs to be compliant, there's a checklist of areas they absolutely must cover. Okay. Think of this first batch as the entire administrative and logistical framework of the lab. You've got that SOP on SOPs we just talked about, procedures for contracts, and then the entire journey of a sample, how it's received, stored, and processed. You also need SOPs for preparing clinical kits and, of course, absolutely critical procedures for protecting patient safety and confidentiality. And the second part focuses on the technical and quality oversight. Our Apex Labs needs an SOP for every piece of equipment and every computer system, how it's validated, used, and maintained. They need procedures for how data is collected and archived. And then you have the big ones that tie it all together. SOPs for quality control checks, quality assurance functions, and maybe most importantly, how staff are trained. Literally every function is documented.
All right, so we have all these perfectly written, controlled documents, but what does that actually look like on a Tuesday morning in the lab? How does a stack of paper or a folder on a server actually lead to reliable data?
This point seems so simple, but you'd be amazed how often it's missed. It's absolutely critical. At Apex Labs, the SOP for using a specific analyzer isn't locked away in some manager's office. No way. It's right there, at the instrument. These are working documents, not museum pieces. They have to be right at your fingertips when you're doing the work. That's the only way to make sure the right procedure is followed, every single time.
And this slide, right here, this is the payoff. This is why we do all this work. A good set of SOPs accomplishes these 5 critical things. First, they are the absolute foundation of your data's quality and integrity. Second, they become your main training guide for new and existing staff at Apex Labs. Third, they guarantee that everyone performs a task the exact same way, consistency. Fourth, they allow you to go back in time and reconstruct exactly what happened. And finally, they are your objective proof to any auditor that you have a controlled, compliant system. It's the cornerstone of everything.
We started by calling SOPs a blueprint, and that's exactly what they are. They are the detailed architectural plans for every single thing that happens in your lab. So I'll leave you with this question to think about. Are your blueprints, your SOPs, clear enough, controlled enough, and complete enough to build the one thing that matters most in our industry? And that's trust. Trust in your data, trust from regulators, and at the end of the day, the trust that protects patients.